Your anesthesiologist will bring you from the pre-op exam room into the operating room, where your care team will have everything prepared for your arrival. After we help you transition onto the surgical table, the anesthesiologist will administer your anesthesia. Our doctors prefer to use spinal anesthesia. The vast majority of patients have an excellent experience with spinal anesthesia, and studies show that spinals are safer for the heart and lungs and can decrease the risk of blood clots. Overall, spinal anesthesia tends to provide the best possible outcome, and most patients are good candidates for this type of anesthesia. A spinal will make you numb and pain-free from the waist down. You will breathe on your own and will also give you some medication to help you feel relaxed. You will feel no pain, and almost all patients are able to sleep through the procedure. You will have the opportunity to meet with your anesthesiologist before surgery and to ask any questions that you might have. While our physicians do prefer spinal anesthesia, the type of anesthesia used is ultimately a decision between you and the anesthesiologist. Both general and spinal anesthesia are common and extremely safe and will be administered by a skilled team of professionals who will do everything they can to ensure you are comfortable during surgery. Your actual surgery will likely take between 1.5 and 2 hours. It will be close to 4 hours before your family will see you after surgery because of preparations in the operating room and the time you'll spend in recovery. But don't worry, the digital displays in the waiting room will let them know where you are in the process. Once the procedure is complete, your surgeon will come out to the waiting room and check in with your family and provide an update. After spending an hour or two in the recovery room, we will transport you up to your hospital room on our specialty orthopedic floor. Your family and friends will be waiting for you there.